became a doctor because I thought it was medical care that produced a healthy population.
Right.
If I look back upon my medical school notes, I went to Stanford Medical School. Back in 1971, I wrote that in the early 1950s, the United States had some of the best health outcomes in the world. But by 1966, so 15 years later, quite a few countries had lower mortality rates than we did. Well, for the richest, most powerful country in world history that spends so much money on healthcare, this didn't make sense to me. So in the late 1980s, at which time some 20 or more countries had better health than we did, longer lives, that is, I went back to public health school and with this question, and what produces health in a population? I'd played doctor long enough, so I knew medical care was really a minor factor in that. And I went to Johns Hopkins, and I came away recognizing two things mattered most. One was social factors, and the other were political factors. So, we have our longest lived state, one could argue our healthiest state, Hawaii, actually recognizes this. In the book, you'll find a graphic on page,
it's really
page 113 of what the Department of Health presents to its public, namely a big mountainside. And at the bottom are the chronic diseases we face as we age. On the shore are the personal behaviors, exercise, diet, smoking. On the other side of the river there is healthcare. So Hawaii situates healthcare way downstream. The river leads up to a waterfall, and in the waterfall are what are now termed the social determinants of health: poverty, environment, pollution, racism. Above that, they situate socioeconomic conditions, and above that, political context and governance. So our healthiest state recognizes the political nature of health production. So what does that translate into meaningful terms? Well, the first part of my book, Inequality Kills Us All, inequality is a choice made by people through the political process. How much are we going to let the rich get away with, and how much will be there for the rest of us? And for reasons that are hard to explain, Americans have chosen, beginning in the 1970s, to give the rich as much as they can possibly take, somehow thinking that it will trickle down to us and we'll all be better off. So that's the difficult thing to try and engage Americans with. First, the question, do you want health or health care? We don't have universal health care. And as I pointed out, we don't have health. Most Americans conflate the two terms. We access health, pay for health, get health, insure health. So that language keeps us from recognizing that that's only about healthcare. And we spend essentially half of the world's healthcare bill to die younger than people in 40 to 50 other countries. We're not getting value for the money we spend.
No, and we'll talk about that in a second, because I think one of the countries you were talking about was Sweden. I know that in Finland also how they treat it is a whole different animal than us. But before we talk about what it is that are the real upstream things that we are really missing here, those things. But I think one of the things you talked about in here is that our sense of such this individualistic identity in this country. And I always talk about this, people who have seen this show for 2 years, for me talk about the importance of the collective. This is when I get called communist Karen and all sorts of things like that. But the idea that even if you are doing well, we are only as good as the least among these are treated. Like, we are never going to be better than that. And I need people to understand that. And so I just wanted to be appreciating you that you were pointing out the importance of this.
Yeah. So, the second part of the title, It Kills Us All.
Yeah.
There's nobody in this country that can escape the inequality that we somehow have structured in our society. A variety of ways of looking at that. The oldest old person, the longest lived person at any one time, is never in the United States. So if we were so healthy, surely, one of our billionaires or some other person would be the longest lived person. That doesn't happen. They're almost always in Japan, Japan being the longest lived country. It was my discovering that in the 1980s. I used to rail against smokers in the emergency department because here they brought this, all the troubles that they brought among themselves to the emergency department, and I had to try and help them breathe. I thought, boy, that's, how can you do this, carry on this habit when it's so bad for you? I then discovered that in Japan, 3 times as many men smoke as in the United States. How does that, how can they be the longest lived country and not be harmed? Well, smoking does harm them, just not as much as it does here. So the context, political context, the place in which you smoke, the country, really matters. So how does Japan get away with it? Well, something I would point out before COVID is, do you ever see a lone Japanese tourist?
No, of course not.
No, they're always together. Do you ever see a lone American tourist?
Funny.
I am the lone American tourist.
So am I. Admit it.
Yeah, so they do things together. They have this phrase "wa" or social harmony, and you suppress your own feelings so that the feelings of the group has harmony and you get along together. So culture is, the culture of wa or social harmony. Culture is the least understood part of public health. And as you point out, in the United States, we all think we're individuals, and what we do individually is what matters, when that's far from the truth.
Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.